The next segment is pandemic management. When the world gets sick, we must protect ourselves and each other. A couple of things we need to keep in mind. There will never be enough vaccines, antiviral agents, hospital beds, uninfected medical staff, or personal protective equipment. So what should we do? We need to adjust our HIPs. An acronym. HIPs. H for hygiene. I, isolation. P, protection. And S, separation. What are some of the pandemic essential equipment that we could find in the facility? We have gloves, the gowns, the N95 respirator, the disposable mask, oxygen mask. We have hand sanitizer, the reusable respirator, the face shield, disposable ventilator and its supplies, and the morgue packs. But let's take a trip through history. Those who don't know history are doomed to repeat it. Those were the words of Edmund Burke. What significant pandemics have there been in mankind's history? Well, 1918 to 1919, after World War I, there was an outbreak of the Spanish flu. Over 21 million deaths worldwide, and over 500,000 deaths in the United States. In Asia, there was the Asian flu from 1957 to 1958, over 70,000 deaths in the United States. In 1968 and 1969, there was the Hong Kong flu. There were over 34,000 deaths in the United States. We also had SARS, 2005, 2009 to 2010, we had the swine flu, and so forth. But what can we say about the latest? COVID-19. Originated in Wuhan, China. There's no known vaccine. Symptoms include fever, cough, breathing difficulty. There's an incubation period of 14 days. And so far, over 4.7 million of confirmed cases worldwide, and over 315,000 reported deaths, and the numbers are climbing. What are the 6 phases of the pandemic? We have, in phase 1 and 2 are known as the interpandemic. Phase 1, the influenza virus may be present in animals, but the human risk is low. Phase 2, the virus is present in animals, but the human risk increases. Phases 3, 4, and 5 is a pandemic alert. Phase 3, there's a human infection with the new virus, but there is no human-to-human spread. In Phase 4, it's limited human-to-human transmission, but the virus isn't adapted to humans. In the Phase 5, the virus is becoming well adapted to humans, but may not be very transmissible. But when we reach phase 6, it's from 6 to 6D. That's the pandemic phase. 6, it has increased and sustained the transmission in humans. 6A, the country has not been affected yet. But in 6B, it has reached the country. And in our case, Puerto Rico will be in 6B. 6C is when the first wave has subsided. And 6D, it's the next wave. Sometimes it comes strong. And after that, if it's controlled, then it returns to phase 1. What is the action of infection control measures? Well, the respiratory and hand hygiene, PPE, yes, the proper personal protective equipment, have visitor restrictions, establishment of screening checkpoints, the triage systems, extend the laboratory hours, identify the high-risk patients and employees, and order quarantine if required. What is the role of the security officer during the pandemic? It's access control, control the crowd, control traffic, protect critical supplies, be on the lookout that these materials aren't stolen, limit visitor access, enforce the visitor restrictions, and safeguard the personal staff. As we can see, hygiene and isolation, they are the key to success. So wash your hands for at least 20 seconds. Social distancing, and keep a distance of 6 feet between one person and another. This way we can stay safe and avoid this pandemic.